Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the US and around the world and give you expert insights on infectious diseases and public health. This is the weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. And I do this with my friend and colleague, Jon Epstein, a veterinarian virologist and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Thanks, Jay. How you doing? You have a good weekend?
I did. It's been good. I've been preparing a bit for Halloween, but in a way that only a public health and infectious disease geek can. I've been working on an essay. I write regularly, as I think you know, for an outlet called HealthBeat, which is a really great. It's funded by the Civic News Foundation, and it's meant to try to bring attention to areas that are kind of undercovered by the news. So they have something on voting called VoteBeat. They have another channel called ChalkBeat that's all about education, and I write for their outlet called HealthBeat.
Nice.
And so I've been working on a Halloween-themed essay, and that theme is about zombies.
Always the great, not metaphor, but I guess simile for epidemiology, right? The zombie virus spreading through a population.
Exactly.
I don't know if that's what you're writing about, though.
Yeah, and I'm not a big horror movie person, but I have enjoyed some of the zombie movies like World War Z, 28 Days Later, or whatever,
Yep.
and a lot of these. I never really watched The Walking Dead, but yeah, CDC has a role to play kind of in a lot of these because it's sort of assumed that one of the ways that people turn into zombies is there's some new pathogen that infects people. And in fact, in 2011, CDC did this really great. It's actually one of the best communication activities that CDC, I think, ever did. And it basically released a graphic novel, like a comic book, all about a simulated zombie attack. And it was meant to teach people how to be prepared for all hazards, infectious or non-infectious, and also kind of teach people about the roles that CDC plays. So my Halloween preparation isn't so much about picking out costumes and getting candy right now, but it's been about how do I talk about how, the real horror story for public health people right now isn't a zombie attack, but it's that we really wouldn't have a public health infrastructure if the zombies did attack.
I know. Well, it is a really great and understandable way to talk about epidemiology. I've always liked that too. And you just reminded me of years ago putting on a Halloween time of year program at the Brooklyn Brewery down in Brooklyn, New York, where it was just a public kind of forum where we discussed emerging diseases and talked about zombies as a way to do it. And in fact, my colleague and I put on makeup and he dressed as a zombie. And while we were presenting, he wandered out of the kitchen from behind the bar as a zombie. And we simulated introducing the zombie virus into the room.
Oh, that sounds great. I think you invited me to that years ago, and it might've been Neil, I think, that went in my place or something like that.
It was great. And yeah, and they're just fun ways to engage with people on this topic. I love Halloween for a related but different reason, because October now is International Bat Month. And so it's always a time when we celebrate the value and virtues of bats as incredibly ecologically important animals. But of course, they're so iconic for Halloween, right? In terms of creatures of the night.
It makes sense. You know what? I should have known that October is International Bat Month.
It's good. Those are the essays I tend to write in October, is, how important bats are to our lives, even though they've been associated with some pretty nasty different viruses that can make us sick. But the take home is that without bats, where would we be? In North America, they control all the insects that can hurt us, like mosquitoes and agricultural pests. And in a large part of the world, fruit bats are pollinators and seed dispersers, and they're so important for maintaining rainforest health. And so I always try to deliver that message when I'm talking about them as reservoirs for disease.
All right. Well, that is perfect. That is a perfect lead in, because we're talking about reservoirs of disease. And what we've been doing, for the past couple of weeks, and I think we'd like to keep doing it, is our infectious disease rounds, where we do kind of a little quick tour around outbreaks that you and I have been finding interesting and are of relevance to the people that listen and watch this show. And so the first one is going to take us to California, and it's to take us to Los Angeles, where there is a outbreak of Mpox. And what's important about this outbreak is that it's associated with a strain of Mpox called Clade I that
Right.
has not been circulating in the United States until now. So the Los Angeles and Long Beach counties of health have confirmed that there have been 3 cases of Mpox in men occurring after the week of October 14th and for several days after that. They don't appear to be linked to each other, but there is a suspicion that they are part of a potentially large sexual network. They are gay, bisexual, or otherwise men who have sex with men. And we know that Mpox has been circulating since it kind of sort of escaped essentially into becoming a global epidemic back in 2022. And this is concerning because this clade or this strain of Mpox is believed to be much more severe or cause much more severe illness than the previous strain that was circulating around the world from 2022 onward.
Hmm. This is another example. We've always focused on COVID as an example of an animal virus that's made its way into humans and established itself as a human pathogen. And historically, Mpox was one of those viruses that it resides in rodents in Central and West Africa, and it's spilled over locally and caused more localized outbreaks. But in the past couple of years, we've seen it really take off as a more international pandemic. And now we're seeing it sustain itself in human populations. Another example of a zoonotic virus that does that.
Yeah, absolutely. And I think, one of the things I wrote an essay in the New York Times in 2022 saying that Mpox was about to become the, next endemic sexually transmitted infection in the United States. And that's basically true. Now, by endemic means it's circulating on a continuous basis. Now, it has been circulating, but it has been at a very low level. And I think that's primarily because it was primarily circulating in sexual networks involving gay and bisexual and other men who have sex with men. And so many of them got vaccinated when the vaccine became available, and we recognize this as sexually transmitted. But it's an example of where, you and I talk a lot about pandemic preparedness. And so we think a lot about airborne diseases
Mhm.
during this, during our podcast today. We're going to talk a lot about mosquito-borne diseases. But this is another dangerous one because it actually transmits through sexual networks. And because sex is so highly stigmatized and so few places, both the United States and around the world, offer really good sexual health services, it has a possibility to circulate for a long time before it gets under control, right? Because people get a delay in diagnosis, so they end up spreading it into other people instead of being recognized and diagnosed and isolated earlier.
That's right. And it's, I think like a lot of sexually transmitted infections, education is a big component of it. It's the risk factors tend to be behavioral in terms of how it's spread, but it can be prevented and controlled. It's going to take a big concerted public health effort, though, to hit on all fronts, but education, vaccination, and really, trying to, speak to the communities where it tends to spread the most. In this case, men who have sex with men.
Yeah, and promoting the early and rapid recognition and diagnosis. So
Right.
much of STI care is early detection and either early treatment or, getting people to avoid interacting with other people until they're no longer infectious. So with HIV, it's let's get you on medications until you're undetectable, and then you can have sex with other people without worrying about spreading that infection. And in this, the concern here is that, Clade I is potentially more severe. We still don't really know the answer to this question completely. It comes primarily from animal models, but it's been hard to study because so much of the severe disease is in places like in DRC and other places
Mhm.
where people have a lot of other factors that could make the disease present more severely, right? People are undernourished. They may have concurrent infections. The quality of healthcare is not nearly as advanced as it is, say, in Los Angeles. And so we're still learning about this. But the reason this was of note is because this strain of Mpox, again, has not been circulating locally until now. Until now, the only cases that have been in the United States have been in people who clearly got it from a sexual exposure somewhere outside of the United States.
Okay. And another African origin virus for our next one, West Nile virus, Jay?
Exactly. Yeah. And so let's go into our second outbreak, which you're talking about. And we have kind of a potpourri for you, John, of mosquito-borne diseases, because
Yeah.
in fact, there are a lot of reports over the past 2 weeks about outbreaks of mosquito-borne diseases, which to me is a bit unusual because we're heading kind of towards the end historically of what would be mosquito season, but that'll be something we're going to talk about. So let's start off here with West Nile virus. So the Minnesota Department of Health has declared 2025 an outbreak year for the West Nile virus, with 107 confirmed cases and 10 deaths as of the 13th of October. And this marks the second highest case count in state history. Now, the thing that's important to understand here is that you're also seeing increases in neighboring states, such as North Dakota and South Dakota, both of whom have had over 80 cases and several deaths. And as of last week, the United States overall was reporting 1,564 human cases, including over 1,000 of those being the ones that infect the brain. So really what you're seeing is much more widespread and sustained transmission across the United States, and particularly in areas that weren't as heavily hit in the past.
I think what we're going to see is with the summer extending, particularly in more northern latitudes, we're going to have mosquitoes around a bit longer. That's a bit more opportunity for transmission. And West Nile virus resides in birds. So birds in North America are the natural reservoir, and mosquitoes that bite both birds and mammals are the ones that tend to transmit it to humans. And importantly, West Nile virus isn't one that spreads from person to person. So these people are getting infected through mosquito bites. And those are probably mosquitoes that have fed on birds that are viremic at the time.
Yeah, and one of the biggest challenges we have for West Nile virus is we do not have a vaccine. We do not have a drug to treat it. So you really are relying on only supportive care. Unlike
Mhm.
Mpox, which we just discussed a few minutes ago, we at least have a vaccine for that. But for a number of these mosquito-borne viruses, we don't actually have very effective treatments and don't necessarily, although for some of the ones we're going to be discussing, we have vaccines, but there are complications associated with using them.
Yeah. And look, we have West Nile virus here in the Northeast, Jay, in New York. And so it's a good time to remind people that even as we're getting into October, it's still warm enough. There are some mosquitoes around. So we want to make sure we're protecting ourselves. If you're going out into the woods or you're going to be out a lot during the day, long sleeve clothing, insect repellent, and on your own property, make sure you don't have standing pools of water where mosquitoes can breed.
Yeah. Well, since we're in New York, let's talk about the other mosquito-borne disease that was reported in New
Mm,
York City or New York region recently. And we talked about this briefly a few weeks ago, but the New York State Department of Health has confirmed the first locally acquired case of chikungunya virus. And this was in a resident of Nassau County, Long Island, who reported experiencing symptoms in August 2025. And now this case has been under investigation for, several weeks actually. And so it was originally reported and publicly in the New York Times, but at that time there wasn't a confirmed diagnosis. But now the New York State Health Department is confirming, in fact, that this is an infection that occurred in a person who never traveled internationally, and they still don't quite know how it is that this person contracted the virus.
Yeah, Long Island's an interesting place geographically. And I say that because JFK Airport is there. And if you think back to when West Nile virus was first introduced to the United States in 1999, it was via the airport, JFK Airport. And there were cases that were around there in Queens, and then they kind of radiated outwards. And so one thing is that some of these what we think of as tropical diseases, sometimes you get stowaway mosquitoes on airplanes in the cargo hold, even though airlines try to disinsect their airplanes, doesn't always happen. So that's one way that these viruses might show up in mosquitoes in a place. And that makes me think of that in Long Island because it's not far from JFK Airport. And then, of course, we have the type of mosquitoes, Aedes albopictus, that can support replication of chikungunya virus and transmission. So theoretically, it could be in the mosquitoes, although I don't think they found it in any local mosquito populations when they were looking, right? They found this human case and they started testing.
Correct. Yeah, and that's
Yeah.
and that's where I think that's why this investigation took a long time, because I think they really wanted to try to identify what is the route by which this person got infected. The New York State Health Department reported that routine mosquito surveillance, essentially where they, grab up mosquitoes, crush them together, and try to see
Mhm.
whether any of these sort of pools of mosquitoes have the virus, and then they haven't detected as well. So the kind of the leading theories remain kind of the same ones. Either one, and a mosquito, stowed away on a plane,
Mhm.
and got loose and transmitted the infection at least to this one person, possibly to other people. The other possibility is, Nassau County does have a large Caribbean immigrant population, and it is certainly possible that a human that who's been traveling to and from, or more than one human traveling to and from the Caribbean region, where you're more likely to find chikungunya, came back, a mosquito bit that person, and then eventually flew off and bit another person.
Mhm. Absolutely. So this is going to be another one we have to put on the list for seasonal surveillance in mosquito populations, just to make sure that we don't start seeing more and more of it circulating in mosquitoes here in New York.
Yeah, and I actually really worry a lot about chikungunya, not because it's deadly, but because it's debilitating.
Right.
And we see this, for example, with Lyme disease infection, right? If you look at diseases around the world that actually kill people, right? That make it so that people can never live again, you wouldn't be worried about Lyme, right? Lyme would be very, very far down your list, but Lyme does receive a lot of attention, particularly in the Northeast,
Hmm.
because the infection can be so debilitating to people after they get it. So even though it doesn't kill people, it certainly makes people feel like they're dead, right? They feel fatigued, they've got joint pain, they've got long-term symptoms associated with infection often. And chikungunya is that almost a much more extreme version, right? It produces an incredibly severe arthritis and just
Yep.
full body feeling horrible. And people can get persistent arthritis and discomfort. And I do worry that, this is the type of infection that could result in a lot of people, just like we have, let's say, long COVID. We just talked about Lyme disease, where it's not necessarily something that we worry about because it fills up our hospitals, but it does fill up our healthcare system and it does ruin people's quality of life. And for those reasons, it's something we have to take very seriously.
Yeah, you're right. And the same could be said about West Nile virus. When you think about one of the worst symptoms or clinical syndromes that occurs is encephalitis. That's brain swelling, swelling of the central nervous system. And though people might recover from that with supportive care in a hospital, there may also be lingering effects that persist if there's been any kind of brain damage due to that. So it isn't always as simple as, get the infection, get through the infection and recover. Sometimes you have debilitating problems that can last your whole life.
Yes, exactly. And that's something we definitely need to, to worry about. And that brings us to our third in our list of, mosquito-borne potpourri virus diseases. And this one is dengue virus.
Yeah,
And
good
just like
old
with
dengue.
chikungunya, dengue, causes severe joint pain. It's called break bone fever, right? Because it felt like your bones were breaking. And dengue is now in the second year in a row. There are now locally transmitted cases of dengue in Los Angeles. And I say that with some surprise in my voice because, I lived in San Diego for 8 years and I originally grew up in the Northeast and, went to college in the Northeast and I just got used to mosquitoes everywhere. And one of the things that struck me when I moved to Southern California in the 90s was, man, there are like no bugs here, at least, if you're
Mm.
kind of closer to the coast, which is where I was in medical school and my training. And so it is kind of surprising to hear about the fact that mosquito-borne diseases are now becoming a problem in Southern California. In 2024, there were 14 locally transmitted cases. And just recently, the first locally transmitted case began developing symptoms in late September 2025.
I think this is going to be a refrain we sing quite a lot, Jay, and that is in the warmer parts of the United States where there are mosquitoes that are pretty abundant. We're going to start to see more and more local transmission. We already see malaria transmission in parts of Louisiana, around the Gulf states there. As you said, the Caribbean now is a lot of, what we call tropical diseases or viruses like chikungunya, dengue, Zika, and malaria circulating. And there are parts of the southern United States that have similar climates that could support transmission. So I think this is something we're really going to have to pay attention to in general.
Yeah, and I think one of the reasons I wanted to, touch on this trio of diseases that we had, West Nile virus in the upper Midwest, chikungunya in the New York City metropolitan area, and then dengue in Los Angeles, because it really doesn't matter what part of the United States you're in right now. Climate change is changing the pattern of mosquitoes for all of us. And all of us need to be more concerned about these risks of viruses that we previously thought of only as tropical infections are now American health problems as well.
That's right. And it's challenging, I imagine, Jay, as a physician now, if you were training in med school, it used to be you were taught, ask about a history of travel. And there were certain diseases that only happen in the South and only happen internationally. Well, that's starting to blend together a little bit now. And I think our clinicians are going to have to continue to expand their, list of rule outs when it comes to vector-borne disease in northern parts of the United States.
Yeah, I mean, I think one of the reasons these reports are helpful is for healthcare providers, right? The average, medical doctor or nurse practitioner or PA or whoever it is that you're seeing, isn't going to think of these diseases normally, and you wouldn't, normally in medicine we try to think of, we say common things are common.
Yeah.
But the reality is that, we do need to be on the alert. And more often than not, it's what we call the astute clinician.
Right.
It's some type of medical provider says, hey, something's weird here. Even though I think it's very, very unlikely, I'm going to test for this thing, or I'm going to collect a specimen and I'm going to call my local health department and say, hey, would you consider testing this patient for this unusual condition? And so, part of the reason I think we're doing this podcast is also to raise awareness among people in the health community.
Mhm.
You got to be looking out that what used to globalization, urbanization, deforestation, and obviously climate change is propelling all of these forces so that we really are, one world, more so than we ever have been.
You're right. And we're talking about these things because they're emerging issues. So we have to also balance this message with these are still very rare events. It is not something you need to worry about the first thing, top of the list. But as we're starting to see new cases, new clusters in new locations, that's when we start thinking about spread. And we're always only aware of like this much when things are really this much. But nonetheless, I don't want to be alarmist here that these are things to pay attention to, but still risk is relatively low for some of these diseases.
Yep, absolutely. Okay. And so, John, you and I have always talked about the fact that we need to touch on some good news. So I did find some good
Yeah.
news this week for us to talk about. But it's not specifically an infectious disease, but it does relate to infections and immunity in an important way. So what I wanted to talk about is peanut allergies, particularly in kids. So for decades, as food allergy rates have climbed, experts recommended that parents avoid exposing their infants to common allergens like peanuts.
Yep.
Basically, don't feed your kid peanuts. But there was a landmark study in 2015 that found that actually feeding peanuts to babies actually cuts their chances of developing an allergy by over 80%. And then 2 years later, the NIH began formally recommending that parents stop keeping their babies away from peanuts and actually start introducing them early. And the good news is that there's now a study out in the journal Pediatrics that found that since that change, food allergy rates in children have fallen. And
Amazing.
particularly dropping dramatically is there's been a 43% drop in peanut allergies. And it's believed that this is due to parents following the new guidance of letting their babies be exposed to peanuts at a very early age.
It's so incredible, Jay, and it's such good news. And I remember when both of my daughters were babies, taking peanut butter and smearing it on the top of their palate early on, knowing this, the study had come out, and just thinking, yeah, it'd be so amazing to, try to do anything to ensure that they didn't have a peanut allergy, because I know it's devastating. And I have friends whose kids have peanut allergies, and it's terrifying. And so this is such welcome news that we now have a new kind of dogma or a new thing to do as parents to try to limit the opportunity for food allergies to occur.
Yeah, that sounds great. And man, your kids are lucky. I love peanut butter. So
Oh my God, so
somebody
do
to come
I.
and say, hey, let me smear this in your mouth. That's kind of good. I enjoy that.
I mean, maybe it was selfish, but I just wanted to, be able to pack nut snacks once in a while, not to
Oh my
school,
God,
but
totally. I mean, I grew up in
yeah,
where my family's from in India, nuts are a huge staple crop and eaten everywhere. So
sure.
yeah, it wasn't until, gosh, I don't remember, since peanut allergies became much more of a problem, I think probably in the 90s and 2000s, I was always surprised that people had peanut allergies because
Yeah.
they were like such an essential component, such an essential snack food. Our parents didn't have that many snacks around the house. They had a lot of nuts because where my family's from in India, it's just very
Oh,
common to eat.
not only are they amazing and delicious, they're good nutrition too. So it's like a great snack, good power snack if you need to grab something quickly. So here's to a healthier, nutful America is what I have to say.
Yeah, exactly. But John, I did want to touch on before we close this topic about
Mhm.
what does this have to do with infectious diseases? And I think the
Yeah.
point that I would make is that, it's believed, allergists believe that many of the causes of these higher rates of food allergies are higher rates of C-sections. So that means that, babies aren't exposed to a range of bacteria and other things in the vaginal canal. That's one
Mhm.
reason. A
Mhm.
second is, early childhood exposure to antibiotics, which can again alter your bacterial and your microbiome. And
Mhm.
the third is our increasingly sanitized environments where, babies weren't exposed to certain things in their environments.
Yeah.
And one of the things allergists have found is that when a baby first encounters something like an immune stimulant through their skin, like broken or inflamed skin, that prompts the immune system to think it's a threat, as
That's right.
opposed to if they ingest it and eat it themselves.
Yeah, I think it's good to keep in mind that we have to train our immune system growing up. And so this inclination or this desire to have a sterile environment around us is actually counterproductive to keeping us healthy, right? You actually want to be exposed to things early on at young age so that you train that immune system to recognize, what is a real health threat, what is not. And it I think makes you more robust.
No, without question. And I think the only thing I want to be cautious about that is, unfortunately, that message, which you've delivered in a very appropriate and nuanced way, has gotten co-opted, unfortunately, by this sort of extreme, it fits in with this Make America Healthy Again movement and things like that, where people have somehow come to believe that being exposed to viruses is good for your body, that being
Mm,
exposed to measles actually strengthens you.
no,
And the
that is
reality
not
is
what I
there is a
meant.
balance here, right? We want
Yes.
to be exposed to a diverse microbial environment
Yep.
while at the same time being protected against the things that are dangerous. And I sort of liken it to, I would like my kids to be, friendly to other people and to learn how to talk and communicate with people. But I also want them to recognize when somebody might be coming to rob them or hurt them and stay away from those people, right? We
Yeah.
need to differentiate. We don't want you exposed to everybody, but we want you exposed to people who are not threats to you.
Absolutely. I mean, it's a good point is that there are things we know are dangerous for kids, the infectious diseases, like measles, and that we have vaccines for. And so it's appropriate to give them the protection, the immune protection for things we know are going to be harmful. But more generally speaking, there are low level things in the environment that aren't harmful, aren't pathogenic, but still stimulate the immune system in a good way.
Yep, absolutely. Okay, John, that finishes our infectious disease rounds. And for our
Mm,
focus topic today, there was a really interesting study that I saw announced, and I thought this
yeah.
was perfect for our show
Great. Great.
because it's about pets, it's about infectious diseases, and it's about the place that you and I live, which is New York. Okay, so a team of researchers, including from the New York City Health Department, studied the lab results from a large veterinary lab that serves New York City veterinarians to see how often, like, antibiotic resistant bacteria, kind of the tough to treat, the last resort types of bacteria, how often these showed up in dogs and cats from 2019 to 2022. They counted each pet only once. They focused on a specific type of bacteria, gram negative bacteria that are resistant to carbapenem antibiotics. And they looked at the patterns by year and body site and neighborhood. And what they found was really striking, right? They found about 1 in 60 samples had highly drug resistant germs, both dogs and cats, but most often middle aged pets. The usual suspects were bacteria that we worry about resistance in: Klebsiella, Pseudomonas, and E. coli. And the problem was steady over time with about 50 to 70 of these detections every year.
Mhm.
And so, John, what do you think about this study? What are some of the takeaways that you got from this?
Yeah, and so really, it's a great study because we need to be doing surveillance for drug-resistant bugs, antibiotic-resistant bacteria, and that includes in pets. And New York City, like any city, is an interesting place because people and pets live at high density, and so the kinds of pathogens that you might have on pets could be a threat to people who maybe are immune compromised. But just backing up here, every study has its limitations, and so the authors acknowledge rightfully that although this study looks at the frequency of detection of these antibiotic resistant bacteria on pets, they limited it to just one diagnostic laboratory, a commercial lab. So they were able to see where samples were submitted from. But what they admit is they don't know where the pets live, where the samples were submitted. So in other words, if you have a pet in Queens, but you bring your animal, you bring your dog to Animal Medical Center, which is on the Upper East Side of Manhattan, and that's where the test gets submitted, it gets counted as a Manhattan sample, even though the pet lives in Queens. So hard to geolocate. I wouldn't read too much into the one zip code, one area, because that may be biased by the fact that the big veterinary hospitals are in that area, Jay.
Yeah, and so, I guess this is you're absolutely right. I mean, I think like all types of analyses, particularly with in trying to detect drug resistant bacteria, you end up with these challenges where you end up the sampling scheme, the sampling frame ends up being a
Yep.
laboratory as opposed to the human themselves, right? So it's always ends up being biased according to exactly what you pointed out to, which is you're not necessarily going to be able to tease out geography well. You don't know as much about the clinical picture in these animals and these cats and dogs. And you also don't have an idea about biases that could occur, right? It could just be wealthier people or people with sicker animals, referring their animals. And so these percentages may not be reflective of what you're seeing in the regular or routine population, right? If you had a completely
That's right,
unbiased
Jay.
sample.
Yeah, no, you're 100% right. And you brought up an important point. Unlike human medicine, veterinary medicine still isn't really dominated by insurance. Most people pay out of pocket for medical expenses. And so veterinary care can be expensive. And to have a clinical sample cultured for what type of bacteria it is and have that sequenced so you actually know the strain and whether it's carbapenem resistant, that's an expensive procedure that people who may be less affluent might decline to do. And so your bias will also skew towards perhaps more affluent pet owners who are going to work up whatever's making their pet sick to that degree. So another thing to consider. Having said that, it is important to understand that pets can either on their skin or sometimes internally carry these resistant bacteria. And I remember reading a study years ago about methicillin-resistant Staph aureus or MRSA, and there were instances of comfort pets going into nursing homes that were just there to, socialize with the patients and were really comfort animals, but on their skin they had MRSA, the dogs. And so as these elderly patients who might be immune compromised are petting the animals, they could potentially get exposed to this Staph aureus that could then infect them. So zoonotic transmission has been seen in that context. In this study, the incidence was pretty low. 1.6% of samples had resistant bacteria. And as you say, that was holding steady. So is that a high number? I mean, it seems like a fairly low percentage to me that I wouldn't think this is pervasive. And we didn't see a growing trend year on year, which is also a good sign. Is there more we could do to monitor and control resistant bugs? For sure. And so I think what this really highlights to me is we need to be doing this surveillance. And it was great that the New York City Health Department took on this study.
Yeah. And so, John, you raised an important point here. The rate of drug resistant bacteria in dogs and cats in New York City is low, but it's not zero. So what would be your advice to pet owners, especially pet owners who are older adults or receiving chemotherapy or have had a transplant, are in some way immune compromised? We often think of dogs and cats as great comfort for people with, disabilities or chronic illness or advanced age. What would be your advice be to them?
Yeah, it's hard because for one, if you're immune compromised, if for some reason exposure to, standard bacteria or resistant bacteria could potentially harm you, you need to think about whether pet ownership is a good idea in the first place, because you're going to be more likely to be exposed, even in an apparently healthy animal, to some of these bugs. For instance, if it has a resistant bacteria on its skin and you're petting it or on its fur. Some of these pets, most of these pets weren't necessarily clinically sick, even though they were carrying resistant bugs on them. So you have to talk to your doctor about whether pet ownership is a good idea for you if you are immune compromised. And the other thing is just, keep up with veterinary visits for your pets. Make sure that you're keeping them healthy. Make sure that if they are showing any clinical signs, you're getting them diagnosed and treated, and that's going to help keep you healthy as well.
Okay, that's excellent advice. Although I couldn't help but giggle a little bit inside when I was thinking to myself, ask your doctor if owning a cat is right for you.
Is right for you.
Yeah, it's like their drug company ads, just like from
It's tough.
television, just like stick in your head. That's why they're so effective, I guess, right?
Well, and maybe, don't kiss your dog on the mouth. That'd be the third piece of advice I have for your cats.
Well,
I
that's
remember learning in vets.
controversial, though. A
I
dog.
know
I'm
it's
not a dog
tough.
owner myself, but man, people in my life who have dogs and love them, they cannot get enough dog kisses. So.
I'll never forget in vet school, and I'm a cat owner, I admit. I love animals, and cats are, what we have in the house. But I remember learning that a cat's mouth is perhaps the most bacteria-filled place on earth. So I think of that every time that cats lick me. And I think, all right, but so just we got to be aware of
Okay, exactly.
those things.
All right. Well, on that note, John, thank you very much for joining me. To everybody who's watching, please, if you like what you're hearing, please hit the like button. Please subscribe. Please comment. Give us feedback on what you like, what you'd like to hear more of. Start some conversations. All these are signals, where our number of subscribers is growing. Not a lot, but slowly. Every week or two, we add,
Word's getting out, Jay.
5 more people. And so we're hoping to spread the word. And as I think everybody's seeing in the news, we're in a time where our federal government is choosing in some ways to disarm itself against infectious diseases.
That's right.
And so one of the most important things that John, you and I can do to help right now in our positions outside of government are to be advocates and keep people aware. So please, if you like what you're hearing, please share it with other people as well. And we look forward to seeing you next week, where we do a little run through of all the interesting news about infectious diseases and outbreaks around the country.
Sounds good. Have a great week, Jay. We'll talk to you later.
Yep. Bye-bye.
Bye.